Hi, I hope you can all hear me. I'm Dr. Jennifer Paul. I'm the Residency Program Director at the University of Rochester. First, I wanted to say a huge thank you to PM&R Scholars for organizing this event tonight. Second, we feel super fortunate to be able to talk about our program and show you guys what it really means to be a resident here. Feel free to use the chat box with any questions. I'll try to answer questions throughout the presentation tonight. Next slide. This slide is our program leadership. So I am off to the left side, and then you'll see Dr. Sarah Salim is our Associate Program Director. And then we have our fabulous Program Coordinator, Kathy Flanagan. She's also on tonight. And our chair is on the right, Dr. Raj Patel. And then we have some of our speakers tonight are our chief residents. On the bottom, we have Dr. Ramzi El-Hassan. On the left, we have Dr. Victoria Kump, and on the right, we have Dr. Sonia Thakor. And then we also have a couple junior residents speaking tonight. On the left, we have Dr. Josh Smith, and on the right, we have Dr. Sean Silverman. And Dr. Smith is going to be starting us out tonight. Josh, we can't hear you.
Thank you. Sorry about that. The first thing that you guys should know about our program is it's categorical. So that means that you do all 4 years here at Rochester, which is, I think, a huge advantage. You know, when I'm starting year 2, I'm not having to relearn any new systems and EMR. You know, I'm able to hit the ground running. I already know a lot of the attendings. I've worked with a lot of them before. So we already even have some of that relationship, and it just makes things a lot easier also when you're calling consults. And people are calling you. The intern year here is amazing. The medicine is second to none. You learn a lot, you do a lot, but the support is incredible. You know, like you guys, I was terrified. I actually ended up enjoying my intern year, and I didn't expect that. So we are a relatively small program. We're currently at 3 residents a year with plans to go to 4 residents in 2022. We have been approved for that spot. It's because we have so many numbers in terms of our caseload that we're able to accommodate taking a second or a 4th resident on without affecting the other residents' caseloads. And the faculty resident ratio is amazing. I mean, you're always at 1-to-1 with the attendings and able to really learn from them and get their perspective. Sometimes it's even more like 2 or 3 attendings kind of all talking together, and you kind of get their perspectives, and it's a real nice meeting of the minds, and you learn a lot from it, and it happens in clinic all the time. Next slide, please. So everyone wants to know about what are the perks of your residency program, and these are important things to consider. You know, work-life balance is always important, and you want a program that's going to think of you as a person and not just a worker. So for vacation days, you know, it's flexible. We have 20 a year, so you can kind of use them 2nd through 4th year as you want, as long as the rotation works out. You just need to request it ahead of time. 1st year, you know, intern year, you get 2 2-week blocks. As for conference days, you know, you get 5 a year. We'll pay up to $1,000 for 1st and 2nd authors to go to the conference in terms of travel expenses, hotel fees, you know, all that stuff. And so that's a really nice way to kind of get exposed to that more academic side of the medicine. You know, sick days, if you're sick, we don't want you coming in. We don't want to work with you if you're fevering, vomiting. You know, if you aren't, great, come in. We'd love to have you. But you get 5 a year. You know, if you're really going past it, it's not an issue. We might need to make some things up. But, you know, people here, if you're sick, please don't come. And for interview days, you know, this is more for the seniors, but you get 3 a year. And then for the interns, like I said, you know, we really try and care about you as a person. It's a difficult time adjusting to intern year. You know, if you need some time to kind of work on things, or, you know, you're having family issues, you can talk to them and get some time off. There's also, you know, we give $300 of book money each year for different academic, you know, really whatever you want to use it for within PM&R. And we do a board review course for our seniors out in Washington. And since we've been doing that, we've had, of the seniors who've gone, 100% of them have passed their boards. So we've been really pleased with that and plan to continue doing that. And just a perk about Rochester in general is it's very low cost of living. I mean, I personally pay $650 a month in rent. I have roommates, so that's definitely on the lower side. But, you know, food, everything else, it's not very expensive. So your money definitely goes a little bit. And with that, I will hand it off to Sean.
Hi, my name is Sean Silverman. I'm a PGY3 here at Strong Memorial Hospital. I'll be talking a little bit about our rotations. So for inpatient, we have two different inpatient units, one at Strong Memorial Hospital. It's a 20-bed unit split between two different residents, so 10 patients apiece. There's two teams, a red team, which sees the stroke and TBI patients. It's led by our fellowship-trained attending, and then a blue team, which is spinal cord and medically complex, which includes LVADs, transplants, and recovered COVID. Total of 8 months, split between 4 months for each team. Our second inpatient unit is at Unity. It's a 25-bed unit. We actually have a little bit more free time there. So you get to see a lot of cognitive evals, PT and OT sessions, swallow studies, really working with the therapist. And there's a lot more you can do. 4 months is there. Then we also have 4 months of consults, all at Strong Memorial Hospital. Consults are all a separate rotation. For outpatient, we have 3 different sports and MSK rotations. Each rotation is with 2 different attendings. 4 of the attendings are PM&R trained, 2 of them have MSK fellowships, and 2 are sports medicine trained. Tons of procedures, tons of injections, lots of time with the ultrasound, and it's truly a see one, do one model in our outpatient clinics. For spine, it's 6 attendings, 5 are interventionalists, and 4 of them are fellowship trained. Similar story, lots of fluoro time, lots of numbers. For EMG, we do 3 months in a row as a PGY4. This kind of allows us to bolster up our basic skills as a PGY2 and 3, and then you can hit the ground running seeing patients as a 4th year. For spasticity management, lots of Botox injections. We also do baclofen pump management, which also includes refills. For our prosthetics and orthotics clinic, it's truly a team-based approach. It's a continuity clinic, and we work one-on-one with the actual prosthetics and orthotics attending and resident. Next slide. Our inpatient volume is more front-loaded. So as a PGY2 and 3, you'll do 4 to 6 months each year. And then as a PGY4, you'll do a little bit less, but it varies. For example, next year, me as a PGY4, I'll have 0 months of inpatient floors and I'll have 2 months of consult. For our selectives, you can see them listed there. This is where you kind of get to tailor them to what you're going to do in the future. So if you're thinking spine or MSK, you can repeat some rotations, really hone in your procedure skills. And if you're thinking inpatient medicine, we actually do junior attending months and you get to see what it's like being an attending. For electives, there's 2 months each. As long as they're PM&R, they can be whatever you want, and these can be away rotations. So now I'll pass it off to Sonia.
Hello, everyone. Thank you for joining us today. My name is Sonia Thakur, and I am a PGY4. I will be discussing didactics and volunteer opportunities. Didactics are an important part of learning in residency. In our program, Thursday mornings are protected times for weekly didactics. In addition, recent months, due to COVID pandemic, they have taken place on Zoom, and this will likely be the case for next few months. Our curriculum has several hands-on modules as well, such as EMG, ultrasound, physical exam modules, and baclofen pumps. In addition, as a part of our focus on board exams, we have twice yearly mock oral exams as well. Next slide. We have excellent faculty members who are always willing to guide and mentor us. In year 3 and 4 of residency, the residents have the wonderful opportunity to choose their faculty advisor. Next slide. Just talking about volunteer opportunities, the most prominent amongst them is SCOPE. SCOPE is a wonderful opportunity during which the first year medical students are actually taught physical exam and history taking skills by PM&R residents. It also serves as a very good way to introduce them to PM&R. We also host the annual Spinal Cord Injury Fair in Rochester, and our residents often volunteer. Now I will pass this on to Victoria.
Hi everyone, I'm Victoria Kung. I'm also one of the chiefs. I want to talk to you about just introduce our call schedule, our call structure. So we're fortunate to be able to take home call as residents. Most of the call is concentrated in our PGY2 and PGY3 years, but that frequency will decrease as the call numbers are reached by your PGY4 year. Next slide. So we also have really quite a broad horizon of fellowship options after graduation, with both opportunities locally and as far as your dreams will take you. So as far as some local options, you know, at URMC, we have a pain fellowship through the anesthesia department, which many of past graduates have trained at. There's also a spine MSK fellowship, both here at UMR. There's a spine fellowship here at U of R starting up this next coming year, as well as another spine MSK fellowship at one of our other local hospitals. And exciting news, we also have an upcoming MSK sports fellowship that will be starting up in 2022. So, you know, just some examples of other fellowships that our past graduates have pursued. You know, interventional spine is very popular amongst recent graduates, and sports and spine is also something that we're pursuing. In addition, also cancer rehab. We had our couple of years ago, a graduate go to Sloan Kettering for her cancer rehab fellowship, and continues to sort of thrive in that environment. So really the job options and fellowship options are broad and deep here. From there, I'll pass it on to Ramsey.
Hey, I'm Ramsey Al-Hassan. I'm the last chief here, third chief. I get to tell you all about the fun that we have in Rochester. So on this slide here, you can see some of the graduations on the bottom left and bottom right. Bottom left, obviously, is our pandemic graduation. On the bottom right was pre-pandemic. But we do all sorts of events throughout the year. We have holiday parties. We've gone bowling, laser tag, curling. We do family events. We go to parks. We've done escape rooms. A lot of our journal clubs are at residence or faculty homes. We do happy hours, and Kathy, it has a wonderful lake house that we go and hang out at a lot too. So we have a lot of fun together, and these are just kind of examples of them as we kind of walk through. And so on the right side here, you see us curling. So Victoria there and our whole crew, and I think I'm in the top right with Kathy, just sweeping. And then on the top left, the laser tag day where we actually had residents versus faculty. And you can guess who took care of business there. I'll just let that kind of be like that. And we throw some Halloween parties. So on the bottom left, you see our Halloween party from, I think that was 2 years ago. And we just, you know, we all like each other. We hang out. The faculty and the residents like each other. And we have a very like kind of camaraderie type atmosphere in our program. So next slide. So this, some of the other things we hang out a lot. So, and there's a lot to do in upstate New York. So you can see some with the apple picking, with sunflower fields. The middle right there is actually my wedding with the residents there. So we actually like each other. We go to each other's weddings. Another Halloween photo on the bottom, Sonia doing a trail run, and some of the now PGY3s hanging out in the top right there, and some of the recent graduates too in the bottom right. Next slide. And so just to talk about Rochester. So, you know, you saw some of the fun things we're doing. We're lucky enough that U of R is one of the major employers in the area. So a lot of people in this area are health wise, and we've had a really good response to the pandemic. And so we are in stage 4, and we are able to go out and enjoy some of these things that I'm talking about today, just to kind of say it. But Rochester is a great place to live in general. Josh mentioned the cost of living super low. He's mentioned a lot of us actually own houses, and we are, you know, enjoying that cost of living a lot. And we have great food, local farms, Wegmans, a local like kind of superhero supermarket that we all love to go to. On the left side, you can see some of our music events. The top left is one of our outdoor music venues that's right on Canandaigua Lake, right in the Finger Lakes. We've got Eastman Hall, which is part of U of R's like nationally acclaimed performance programs for music. And so we have some really great arts here. And on the bottom left, you see one of our music festivals. We're very much a city of festivals, and we do have a lot of fun with that too. Next slide. So we also have a lot of museums and things to do as a family. So on the top left, you see the Rochester Museum and Science Center. And in the middle is Strong Museum of Play, which houses the National Toy Hall of Fame. Inside of that building is the butterfly exhibit, which is on the bottom left. And then on the bottom right or across the bottom is Lamberton Conservatory. We have a lot of greenhouses and things you can go to and really enjoy as well. So next slide. So again, we have a lot of kind of natural things to enjoy here too. So we've got the Erie Canal, maybe less natural, man-made, but a nice waterfront. We've got the Finger Lakes, we've got mountains, we're close to the Adirondacks, we've got beer trails, wine trails, all sorts of fun things to do through all 4 seasons. So we have a lot of fun, and you can see in a lot of pictures, this is us actually at these places or taking pictures of these places ourselves. Next slide. And so Letchworth is another one of the great state parks around here. The Great Lakes are here. So we've got Lake Ontario, some fishing there. And again, you see like the beach along the Great Lakes, the Erie Canal. And so we really have a lot of fun. So Letchworth is like a huge national park. They call it the Grand Canyon of the East. And so Sean is there enjoying it by one of the waterfalls, and see a lot of us near the canals and having fun. So next slide. So again, we get all 4 seasons. We've got a little bit of city, a little bit of the country, a lot of natural things to do and go out and have fun. It's just a really great place to be. So, you know, it's a really fun time to kind of learn and grow and share with people that really like each other as part of the community here at U of R. Next slide. So just to kind of sum up, you know, you can get a lot of our information on our website. Hopefully gain some information
2 minutes left
here listening to us today. You can check us out on our Instagram account, URMC PM&R Residency. We're pretty active on that. You can see a lot of things we're doing and see a lot about Rochester area. There's a video tour on our website. We're doing medical student rotations, virtual rotations even, where you can apply through our website as well. So thanks for being here. Thanks for listening to us. If you have any questions, we have like a couple minutes. You can throw it in the chat. Just kind of speak up. We're happy to answer anything that you'd like. So there's a question from Luck Lam. How much time do residents have for anatomy and ultrasound training? So we do a lot of one-on-one training with our faculty. We have a lot of MSK sports trained faculty who are fellowship trained and do a lot of one-on-one training with the ultrasound machine. We have the stipends that Josh talked about to go to local courses, where actually a lot of our own teachers are and attendings are the ones who teach the courses. So we definitely have a lot of hands-on, and we do our Thursday morning didactics with a very specific anatomy component to it. And so we do a lot of anatomy and ultrasound. There's a question about, could you tell us a bit about what kind of mentorship is provided for the residents? So we do pick faculty mentors, and at first we kind of stick with Dr. Salim, who you met or you saw, and on our first slide, and we kind of pick our own based on our interests, and there's always open doors. Dr. Paul, Kathy, they're always there for us, so there's no question the attendings are there to really mentor us and guide us. And evidence of that is that everybody who wants to go into a fellowship has gone into the fellowship regardless of the field, and we do really well with that.
And at this point, we'll transition to Jefferson, but you may continue to ask questions in the chat. And University of Rochester, thanks so much. That was outstanding.
Thank you.
Thank you so much. We appreciate it.